Grabbing shoulders leads to grabbing necks, and grabbing necks leads to injuries, okay? I've seen it happen with therapists, and then they become therapists and patients. So we
don't let them grab your shoulders?
do not, like coming up to stand in particular, like don't ever have your patient grab your shoulders to come up to stand. If they don't want to push off the armrest and they want to grab onto like your forearms, that's okay, but not the shoulders. All right, and then you can do the gross muscle testing, and I'll just be the patient so everyone else can watch.
Okay, so with the gross muscle testing, we're not going to test like very specific muscles. We're just going to do muscle group, like a general muscle group. Okay, so what are we trying to figure out grading wise?
Upper body.
Upper body and lower body, and then what's going to be our cutoff?
3,
right? Okay, so if Dr. Parker can go ahead and flex his shoulders here against gravity, pretty good.
Yeah.
So that's what?
3.
3, right? You can always add a little bit of resistance to kind of see where he's at. Oh, hold it right there, don't let me move you. But you're not really like cranking him. It's not going to be a full-on MMT. Okay, and then so that's going to be your shoulder flexion, and then I always like to say like, okay, can you make a chicken wing like this here, right there? So that's the 3, right? And then a little bit of pressure here, hold it good. Any pain with that? And then lifting up here for adductors. Okay, and then going in. I typically like to do like one side, then the other side. You can go back and forth, but if you do one side, you may forget to do like one side on the other, like maybe the grip or shoulder flexion or something like that. So always try to make it like, okay, I did shoulder flexion here, I'm gonna go shoulder flexion here. I did elbow flexion here, I'm gonna go elbow flexion here. Okay. So for elbow flexion, we're checking the biceps here, and then I'm gonna try to go ahead and pull you out. Don't let me pull you out. Good, hold there. And then for triceps, we're putting pressure here, hold it there, good. And no, I'm not crossing the wrist here. We want to put the pressure here. Okay, and then grip. You're gonna go ahead and squeeze my fingers, good, and relax. And you do the same thing on this side. Okay, so chicken wing for me over here on this side, good. Full range of motion against gravity, so it's a 3 automatically. And push here, hold, and then hold here. Any pain with that?
Nope.
All right, you're gonna go back into bicep curls. Can you go ahead and do this motion? Good, and then hold it there. Good, now I'm gonna push in, hold it. Good, and grip. Go ahead and squeeze. All right, perfect. Any questions on that upper?
What muscle group did you forget for upper body? Helps you come up to stand.
Shoulder extension?
Oh, adduction.
Elevation.
Oh, depression, okay. Sorry. All right, so we're gonna go right in here. All you're gonna do, thank you. All you're gonna do is try to pull him out of depression here. So with 2 hands, we're gonna go up, hold it, perfect. And then on the other side, safety.
Safety first.
Safety first.
I'm a smart patient.
There we go.
Most of your patients aren't this smart though.
And then same here for shoulder depression. You're gonna apply pressure here and hold, and perfect. So wasn't able to break him. And
So, well, go ahead.
your patient cards will tell you what grade you are, so you kind of want to mimic like a 2. That way your therapist knows like, okay, I need to do this transfer versus another transfer.
So we're going to teach you how to do this in the bed as well. Generally in the chair, you should do shoulder, shoulder, elbow, elbow. And then as the therapist, you can cross your hands and have them do both squeezes at the same time. So that, like Dr. Salazar said, you might forget what one was compared to the other, but sitting in the chair, it's not too hard to go from one side to the other. When we do it in the bed, you can do the whole right arm, then go to the other side, do the whole left arm, and then you might as well just stay on the left, do the left leg, and then go back over to do the right leg so that you're not sprinting back and forth from one side to the other. So seated, go joint by joint. bed go extremity by extremity. So we're not asking you to do 3+ versus 4-, but you should understand 5 versus 4 versus 3 versus 2. Your partner should be able to act that out okay. If your partner doesn't act it out okay and displays something different than what was on the card, I might just let you roll with whatever your partner demonstrated, or I might say, no, that was actually supposed to be a 2, not a 5. And then you would go based off of what I told you. But generally, I'll try and not break up your swing of things and let you, unless you're like the second partner to go and your partner demoed exactly the same thing that you did, we're not going to let you do that. So, okay, lower extremity.
Yes. Okay. So now moving on, we want to do hip flexion and extension. Okay. So I'm gonna have the patient. Okay, can you lift your knee up like this? Good. Hold it. Don't let me move you. A little bit of pressure there. Okay. And then for extension, for quads here, I like to put my forearm underneath here and then position my hand on the opposite knee here. And we're gonna go ahead and kick out for me, and then hold it right there. Good. And then for hamstrings, we're gonna just pull straight out. Okay. So hold it right there. Good. And now dorsiflexion and plantar flexion. Toes go up for dorsiflexion. Hold it right there. Good. And then plantar flexion. Go ahead and push down. And then I'm gonna try to apply some pressure. You can have the leg extended a little bit so it's a little bit easier for you to get underneath and push. Good. Same thing on the other side. You want to check in with your patient, make sure that there's no pain with any of this. You will not do a gross motor assessment if they have like a hip replacement or a knee replacement. You can defer the entire extremity, or just don't test the two joint muscle groups. Does that make sense? So if they have like a hip replacement, you can definitely do like dorsiflexion and plantar flexion, but I would defer like the hip or the knee. Okay, so again on this side, make sure your body mechanics are good. Go ahead and bend here. Good. Hold it. Don't let me move you. Perfect. Oh, I forgot hip extension. That's what I forgot. All right, keep it down there, and then don't let me pull you up. Okay, and ready. Hold. Perfect. So hip flexion, hip extension. Okay. Now we're going in for knee extension. So go ahead and kick out for me there. Hold it right there. Beautiful. And then don't let me pull you out. And hold. Perfect. And then you can extend the knee a little bit. Bring your toes up towards your face, please. And dorsiflexion there. Hold. Don't let me move you. And then plantar flexion. Go ahead and point the toes down. And hold. Good.
So you're starting with these tests before you actually do the transfers and all that stuff.
Yes.
But say they have their shoes on and or not, would you just say like,
Yeah,
I'm washing
so
my hands now? and
so
I wash my
generally, especially if you're going joint by joint, just do like dorsiflexion on both feet and then do plantar flexion on both feet. So then you only have to sanitize
Once.
one time.
Okay.
Very important for like the plantar flexion to have the heel down, because if the leg is up and you're testing plantar flexion, now depending on like how you're pressing, you might be testing like quads, hamstrings, hips, or something, again depending on the line of force. So make sure the foot is down there. So the general layout of the whole practical is, again, we said either the patient's sitting in the chair, you're going to transfer them into the bed, leave them in a certain position, you'll have your diagnosis. Did we go through, we haven't done informed consent yet, have we, for this course?
I don't remember.
We went over like date of birth and checking.
Yeah. Confirm date of birth.
Okay,
and
so yeah,
name.
so you're
we
going to do
did
your
that.
informed consent, the benefits of treatment, all that stuff, we did go through that.
Yeah. Yes.
So you're going to go through all of that with your patient before putting your hand on them, and then, okay, I need to perform a gross motor assessment to see what strength you have and help us choose the appropriate transfer you do that, and then you perform the transfer, get the patient in bed, leave them, call bell, don't make any mistakes on the lay, get 100, hooray.
Yay.
So let's practice this, and then we will talk about how we do it if the patient is supine in bed.